Hi, it's Dr. Charles Garramone. I am answering questions from previous questions in the past, and I'm going to go down the list to the next one. This one states, I am a trans man who almost 1 year on T. What weight or BMI do you require for top surgery? I don't require any BMI for top surgery. I've done surgery on patients with very low BMIs, patients with very high BMIs. I think one of the heaviest patients I've performed surgery on, they were over 450 pounds. That was many years ago. There are some specific anesthesia restrictions for certain BMI patients for outpatient surgery. This has the reason behind this is it has a lot to do with airway compromise, and obviously the anesthesiologists are very concerned about that. As you get heavier, your airway becomes more of a higher risk as far as establishing a safe airway while you're under anesthesia. This is something that the anesthesiologists have been following for many years, and this goes across the board. It's not just in this particular type of surgery. You can do surgery on patients who have high BMIs. If they are at a very high risk, they would probably recommend doing the surgery in the main hospital as opposed to the outpatient surgery center at the hospital. Rough guidelines, roughly having a body mass index of over 45, upwards of 50 would really restrict you from having an outpatient surgical procedure. If you have a much higher BMI than this, you would have to have this done in the hospital. And then sometimes in the hospital with an elective procedure such as this, a lot of times the anesthesiologist would still recommend you lose weight to get your body mass index below 45. Now, that's not being said that somebody with a body mass index of 45 does not have a safe airway or not be at increased risk for having any airway compromise with surgery. So that's in general, patients who have a body mass index over 45 are at increased risk for problems and complications. Now, as far as body mass index, for my guidelines, I always recommend patients try to get their body mass index below 35. Part of the reason why is because as you get heavier, a lot of us tend to carry our fat in different areas of our body. One of them is the stomach, the abdominal region. That becomes very heavy, and it starts to pull down on the chest incision. So you can imagine you have these nice fresh incisions from the chest surgery, and you're 100, 150 pounds overweight. A lot of that weight's being carried in your stomach area, and that's pulling down on these incisions. There's only so much tensile strength that the sutures and the staple materials can hold, and you have a higher risk of developing something called wound dehiscence. And that's where the incision opens up, and you can have wound healing complications and difficulties with healing later on. So I recommend getting below 35. That is a recommendation. It's not a hard rule, but if you can do it, I do recommend it. If you need some advice on how to lose weight, I can definitely help gear you in the right direction. But for the most part, the body mass index question, this is a great question. I get asked this all the time. Hopefully this helps.